You know, every month we go visit one of the specialty departments at Singing River Health System here in Pascagoula or in Ocean Springs. We talk to some of the specialists, doctors, RNs, therapists, and find out some of the great things that they're doing. Well, today we're here in Pascagoula. We're talking to Phillip, who's an RN with CRC. What is CRC, Phillip?
So CRC stands for Comprehensive Rehab Center. We're a 21-bed inpatient rehab facility located on the 4th floor of Singing River Hospital. Most of our patients come from in-house, but we take them from all over the coast.
Now, what type of, exactly what type of things do you deal with?
Our biggest population group is our strokes. Unfortunately, we've been getting a lot of young strokes lately.
Really? Young?
Guillain-Barré, a lot of neurological issues, Guillain-Barré, MS, multiple dystrophy. And a lot of people just come up here debilitated. They've been in the hospital, been in the ICUs for days, weeks, and just deconditioned, and they come up here for therapy with us.
Mm-hmm. Talk about the team. What kind of group do you have here?
We've got a physician that comes and sees patients 7 days a week. There's always an IPS doctor on call on nights, weekends. There's 24-hour nursing care. Therapists are here 6 days a week. We have occupational therapy, physical therapy, speech therapy. So we've got the whole gambit. So.
Now, when we're talking about CRC, your comprehensive rehab center, we're not talking about like if you break a leg and you got to learn how to walk or something like that. You do that?
Yeah, we do. We get
pretty much the whole gamut of things.
90-year-old hip fractures to 20-year-old car wrecks that are having to learn to walk again. So we see the whole patient population.
Yeah,
so.
I think that's one of the great things too about Singing River Health System is the broad spectrum that y'all cover with treating so many different people. As I mentioned at the beginning, the different types of doctors that I've spoken to over the past couple of years coming to the locations here on the coast, and especially the newer ways. I mean, so there's always changing. The science of rehab makes it easier and faster for the patient to get better.
Yep. Dr. Thomas Stevens is our medical director. He's a geriatrician by trade, but he's always up here, always detailed in his treatment. He's been here over 10 years, and so he covers our floor, and Dr. Hull covers us when he's not here.
Now, in these times of COVID, how has the team contributed to working with these patients?
So all of our patients are actually tested before they come up here to clear them from COVID. So with the COVID patients we do have are cleared before they come up here because we have a community setting. Mm-hmm. So they're cleared usually 2 weeks after their last positive, and they come up, and we've had multiple COVID patients that have had good results up here. Okay.
Well, I know that you've got some great people working with them, so let's talk to Wendie and find out more about what they have here with CRC at Singing River Health System. Now, Wendie Hawkins is Program Director here at Singing River Health System CRC. How are you?
I'm fine. How are you doing?
I'm well. Tell us a little bit about yourself.
Well, I'm the Program Director here at CRC. I've been here about 4 years, and I also have my doctorate degree in physical therapy.
Okay.
I love this team up here. We meet together with the physician, respiratory therapy, OT, PT, speech. We all come together to do what's best for the patients and help get them home.
Y'all have won several awards.
We actually have. According to UDS, there's over 1,000 rehab units in their database, and we consistently score in the 90th percentile.
Wow. Well, how do you know if CRC is right for you?
Well, there's a lot of ways. Basically, we take 60% of our patients have to be of certain diagnosis like Parkinson's, MS, stroke. We're actually a stroke certified unit, and we're CARF certified on top of that. So any kind of problem that you have, we can usually work with that, and especially if you have medical needs. Our physician is board certified internal medicine, and so he sees the patients every day. And so we do see a large amount of geriatric patients. But if you've had a decline in function and you've been in the hospital, feel free to call 228-809-4051, and we can talk about if CRC is right for you.
So do they need to get a referral?
We do prefer a referral from a physician, but if a family member calls, we'll usually ask them who their physician is, what doctors they see, and then we can call the physician and ask if this is right for them, if they feel it's appropriate.
That's awesome. Thank you, Wendie.
Yes, and we also, we provide excellent care to our patients, and that's part of Singing River. We provide compassionate quality care, and this is developed into a culture of safety that drives high patient satisfaction, and this produces excellent results, as you'll see with all our awards that we've won. And this marries well with Singing River's mission statement to improve health and save lives in our community every day. We're a community hospital, and that's our goal.
Well, let's talk to one of the nurses that works on the COVID center floor working with the patients for their rehab. And Miranda Hurst is an occupational therapist assistant here at Singing River Health System. How are you?
I'm doing well. How are you?
I'm well. Tell us about your work, especially with the COVID patients here.
Our job with occupational therapy, it's not just going back to work, it's actually the work of your daily life. So what we're doing is we are helping these people that have been, they're at rock bottom, hard to breathe, can hardly sit up unsupported, and we're working from the ground up to get them to the point where they can get in the shower, do things as simple as eating, because when you've gone through something like COVID, you're so weak that the things that we used to take for granted, just things that we did every day, are very, very difficult. And that's why occupational therapy and rehab within itself is so important.
Now, I saw the story about the lady that, it's on actually YouTube, there's a YouTube link on it, the lady that went through, I can't remember her name, Lillian or something like that, that went through COVID. Really, really bad condition. And when she came back going through with CRC and occupational, with the therapist and all this, and just has come back strong.
Yeah, she was actually my patient, so that was very exciting to see. Hardworking lady, but again, she was one of those that when she got here, just even sitting up in a chair was so difficult for her, and had to have help even putting silverware to her mouth. And so when she left, she was walking, she was talking, her energy had gone up, she was able to get more of her life back so she could function in her home. And that's what we do here at the CRC.
Well, that's a great testament to y'all. I mean, it really is. I mean, the work that y'all do with it, and you take it very personal.
Oh,
in
absolutely.
working with these people and making them, feel like, hey, we're family here.
Yes.
And we're going to make you feel better about
Right.
things.
This is a community hospital.
Right.
So our patients that are here, you're going to see their uncles come in at some point. You're going to see one of their coworkers come in. We run into people that know people all the time because this is a community hospital. And so it's an honor to serve back our community in this way.
As I mentioned in the beginning, I've done so many of the different, talked to so many of the different doctors and physicians and therapists and everything that work here. Y'all do. Y'all have a great organization here.
Thank you. I'm quite proud of it.
All right. Thank you, Miranda.
Thank you.
If you'd like some more information, of course, you want to find out, as Wendie said, give them a call. Find out if you need to get a referral to come here, or any kind of therapy that they have, because they have a great occupational therapy group here. Singing River Health System. We're at the location in Pascagoula.